Thank you very much. It was very inspiring and very clear. I know today what NPI is. Thank you. So I introduce myself alone. So I will present you something a little bit on the side, but very complementary. I think you talked about registry, and this was one of the main keywords which drive us to go on with our project. So it's a pleasure to be here with you, and I don't know how many are online, but I say hello to them too. And I thank the host, Professor Gregory and Dr. Gianni Franco, for having invited me for presenting at this first European Non-Pharmacological Intervention Forum on the sensitive topic of data sharing. So the title of the presentation contains all the keywords: European data sharing and acceleration. With the aim of moving beyond a speech full of wishes, promises, and hopes, we have built a model based on a European law, the Data Governance Act. I have to push on a button. Entrée. Ah. So the aim, I tell you what it is, and this law is the Data Governance Act, which was published on May 22, enter into force in September 23, and recognized by the EU. So this law or regulation provides for, recognize, and encourages data altruist organization. See the logo here. So let's remind ourselves what data altruism means. It is a voluntary, it is written, the voluntary sharing of data on the basis of the consent of data subject to process personal data pertaining to them for objectives of general interest. So since the DGA, this law, is a regulation, it is, it is automatically applicable. This is important because people don't realize it. It is automatically applicable in all EU member states as soon as it enters into force, without the need for transposition into national law, although then administrative adaptation may be necessary for uniform practical application. So the Belgian ministry, I think it is the first one, put those administrative adaptation on the Belgian Federal Parliament that was approved on May 8th. I must tell you that this was the last time that the federal government could take some decision, because since then, like France, we don't have any government anymore. So the next step to reach, and it is also an important word that was mentioned previously. The next step to reach for our action is implementation. In fact, the patient cannot share their data because they do not have them, even if GPDR and Article 15 and 20 of the DGA provide the right of access and right to data portability. Portability is also an important word. Portability is, what is portability? Right. One day, okay. Portability facilitates the transferability of data from one environment to another. In the context of an association of altruist data sharing collective, this portability enables individuals to move their data to platforms or projects engaged in ethical and transparent data sharing initiative for the public good, without technical obstacles. Well, this is difficult to implement by individuals. This is a fact. Okay. So we thus decided to launch a framework where data can be shared securely and responsibly while respecting the rights of individuals. The slides next one illustrate some aspects that drive us to launch a European Brain Data Hub. So, as you see, it's an international not-for-profit patient-centric data altruist organization fulfilling all the conditions of the DGA and Chapter 4, because everybody say no, and GPD and you cannot, and the security and so on. We based it on the law. And I have a very good lawyer who is working on that. That will receive in any European country a legally validate mandate from patients to collect their data health on their behalf on the basis of Article 20 and 22 and the GDPR, in order to share their data on the basis of a broad consent form, Article 25 of the DGA, for improving research and public policy, and giving to patients tools to monitor the use of their data and to withdraw consent at any time. So it's a dynamic process. So the model is very easy, very simple, I would say. The patient is at the center. He gives his consent according to the DGA. And this has still to be written at the level of the DG Connect, with whom we are in contact. And the patient also gives us a mandate according to Articles 15 and 20. With all that, we can fulfill the Brain Data Hub, and we have also, with a mandate to go to the data provider, and with the data provider, we have to, this is a model, it's not yet in application, of course. The data provider, we have to make some contractual agreement, and you can imagine that there will be some resistance. Hospitals are not ready to share anything, for instance, not only. And then with all that, we have the hub who can collect the data. Of course, the data users who will use the data for research, for clinical science, different, this has still to be in the public interest. The data user, we have to negotiate with them a code of ethics and a license, how they can use it. But this is a model, so it's very simple. And so this international association was just created on May 14 with Philippe Gorwood from the French Brain Council, who is also a psychiatrist, head of Hôpital Sainte-Anne in Paris. The German Brain Council with Professor Thomas Mokusch, president of the German Brain Council, myself dealing with the Belgian Brain Council, Dr. Christina Dalla from the Hellenic Brain Council, and the notaris to collect all the signature and make it and submit it to the royal decree. So in conclusion, this European Brain Data Hub is complying with all legal duties, and we have received from our patient association the consent, so we are ready to start this innovative approach for data sharing. The next step, the details, depend only today on fundraising. So we have put a business plan for this phase 3, and it is now in the hands of our partners. I thank you very much.